Well, good morning to everyone who's joined us today for our webinar, Caring for Yourself While Helping Others. I'm Kim Bailey of Alzheimer's Orange County, and as always, these complimentary webinars are brought to you through a collaboration with our community partners, O'Connor Mortuary, CareChoice Hospice and Palliative Services, and Alzheimer's Orange County. And we provide these monthly webinars so that we have an outlet for you to provide continuing education on a monthly basis on all of the latest issues related to the senior industry. And today we are so pleased to have Becky LaMacca back with us. She is going to be presenting on this important topic, how we can care for ourselves while we're helping others. Let me tell you a little bit about our speaker now, Miss Becky LaMacca. She is the Director of Grief Support and Education at O'Connor Mortuary. Becky holds a master's degree in counseling psychology, and her specialty is certification in thanatology, which is death education. After spending nearly 2 decades in senior care, she signed on at O'Connor in 2013 as their Director of Grief Support and Education with a determined passion to bring education, encouragement, and validation to the professional and volunteer communities that we interact with. Becky believes that education is our most powerful tool in our efforts to help the community learn more about how to cope with death and the journey of grief after loss. Through quarterly workshops, seminars, and in-services, Becky is continually spreading awareness and changing grief care for the better. On the personal side, Becky resides in Irvine with her husband, John, and their 2 boys, Ben, who's age 14, and Sam, age 12. She spends much of her free time at hockey rinks across Southern California watching her 2 boys play ice hockey. She also enjoys Pilates, backyard gatherings with friends, and walking her yellow lab, Sandy. She's currently so involved in the community. She serves as board chair for Our House Grief Support Center in Orange County. She's the chairperson for the Irvine Prevention Coalition and sits on the advisory council for the Trauma Intervention Program. So we have an eminently qualified speaker today. And I think you're going to enjoy this topic because it's really something that we need to look closely at as we care for others. So I'm going to turn it over to you, Becky, with our thanks.
Well, thank you so much, Kim. And I am excited to be here this morning with all of you. And as we were planning this webinar, we thought, what a perfect time of year to talk about caring for ourselves. And really starting out the new year with hopefully some practical tools for all of you to take with you today and bring into your work that you do. You see on your screen some of the objectives that we hope to accomplish today. Being able to explain the causes and effects of stress and compassion fatigue, identify strategies for providing support without jeopardizing your own personal health. And then really the nuts and bolts of today is creating a personalized and easy to use plan for you to manage stress and prevent burnout. So as we get started today, I really wanted to start with carrying on conversations with our clients, our families that we serve, our patients that we're seeing. I think all of us got into this helping, caring profession for reasons of passion. We were drawn to this, but some of the very things that cause us the most stress are having these conversations with our clients, patients, and families. And I think we need to examine how our work language affects us personally. We all have our personal attitudes toward illness, toward end of life, toward death, and these are influenced by our personal, our cultural, our social, and our spiritual beliefs. And these attitudes are attached to our own human emotion. And I think as as we look at our work, we have to really be aware of our attitudes and our patient and family and client attitudes. We may have opposing thoughts, and that can cause a lot of stress. We were just meeting with one of our community partners yesterday, and we got on the topic of our clients are wonderful to work with, but sometimes it's the families that that we don't see eye to eye with. We're doing what what they were saying to us is we're doing what we feel is best for this individual client, yet the family has opposing views, and that's all very stressful. I think many of us lack confidence in our communication ability when it comes to talking, having those really difficult conversations about end of life, death, dying with patients. I know many of you have seen the Being Mortal screening, and that's really some of the dialogue throughout that movie is how do we get more comfortable with these difficult situations. One thing we know is we can't always fix the family system. What was broken before they became our client will probably remain broken. And then considering cultural context. It's okay to ask families and say, tell me about your culture, tell me about what you think, tell me about your family's tradition with this particular thing. I think a lot of times we may get a little nervous asking families if we don't understand. It has been my experience that if I am open and honest and say, gosh, you know, I really don't know much about your culture. Will you explain a little to me? Families are really relieved. Clients are really relieved to hear that. And then, of course, paraphrasing, making sure we are listening to understand what our families, what our clients, what our patients are saying to us. I like to ask open-ended questions. I tend to avoid asking why, only because it can sometimes come across as judgmental. And then, of course, remembering our nonverbal communication, especially if we're working with our older clients, eye contact, listening to understand, talking with them at their level, if they're maybe in a wheelchair, sitting down and being able to make eye contact with them. And then, of course, we all need to be aware of our own personal issues and fixing boundaries in advance. Sometimes when we are working with our clients, it's just a little too close to home. And what a client or a family may be experiencing is really mirroring something going on in our lives. And we need to have a healthy way of processing our own issues. So how do we apply our knowledge of grief to best support? We're going to get into a little bit about modeling good self-care, giving permission to grieve, acknowledging loss, and being aware of our own beliefs and attitudes. One thing I do want to say here too is humor. Humor is a great coping mechanism. Many of us, I'm sure everyone who is logged in today, are dealing with really intense situations with the people and the families we are serving. And as a group and as colleagues and coworkers, sometimes we use humor as this coping mechanism. My only caution is just to remember that we never want to talk about a specific person, and language is so powerful that we really want to be careful that the language we're using is not only in front of clients and families, but with each other too. We never want anybody to feel that we are laughing at them, even though we can use humor as a coping mechanism. So what can we do? You see, model good self-care, give permission to grieve, acknowledge losses. We need to give ourselves grace and accept the fact that we as the caregiving professionals, are not immune to illness, to trauma, to loss. We have the same processes and experiences as everyone else that we're serving. And making that connection and owning it, it's okay. It's okay, and it's okay to let others know that it's affected you. So how do we apply our knowledge to best help and support not only the clients that we're serving, but ourselves? Well, one way we're going to talk about, and I apologize, I'm fighting a little cold, so you might hear some coughing, is modeling good self-care. And giving ourselves and giving those around us permission to grieve. And I put this in here because I think it's important for us to remember, especially with the clientele that we're all working with, grief isn't always associated with a death loss. For those of you who are RCFEs on the presentation with us today, you know families are grieving the loss of having to leave their home and move in to a new place. There's a lot of anxiety associated with that. And for us in particular too, we may be grieving losses or changes within staffing within our companies. So just keep in mind that grief can be related to non-death losses as well. And acknowledging these losses, being aware of our own beliefs and attitudes. Brene Brown is a licensed medical social worker and a research professor at University of Houston Graduate School of Social Work. And I'm sure many of you have seen her TED Talks. She has some fabulous books. She's really spent the last decade studying vulnerability, courage, worthiness, and shame. And one of the things that she really focuses on is our need to allow ourselves to be vulnerable and to be comfortable in doing so. So before we get into some strategies to create our own personal plan, let's take a look at some definitions. So I know this is pretty lengthy. This is the definition of compassion fatigue. And some of the words that jump out at me are prolonged exposure to compassion stress, emotionally draining clients who look to us for help, re-experiencing traumatic events, avoidance and numbing, cumulative stress burnout. I think probably everyone on the line today could relate to some of these phrases, especially the emotionally draining clients who look to us for help. Next, we have secondary traumatic stress disorder. The first thing that comes to mind when I read this were exposure to the traumatized person rather than to the event itself. Was a couple of months back with our horrific mass shooting in Las Vegas. The weeks following that shooting, I had a lot of calls from healthcare professionals looking for resources for people they were serving here in Orange County who were affected by that shooting. And it did affect those healthcare professionals. They weren't there, they weren't a part of that shooting, but treating those victims who were there really affected those healthcare professionals. And then vicarious traumatization. When the other trauma workers experience results from an empathetic engagement with the client's trauma. And that really goes along with the secondary traumatic stress disorder. And then burnout. You see some of the symptoms: sleep disturbance, headaches, irritability, aggression, pessimism, the feeling of powerlessness in achieving work goals. So these are all things that we can experience in our high stress caring profession jobs. But ultimately, this is where we want to be. Compassion, satisfaction. The pleasure derived from the feeling of doing one's caregiving work well. And I think this is all, every single one of us, this is why we got into the business that we're in, is compassion, satisfaction. So we're going to spend the rest of the morning talking about how we can either get that back or keep that compassion, satisfaction. Here are some common stressors and really what's at the root of compassion fatigue. And I'd like to read a case study. Nancy. Nancy's 36 years old. She's a single mother of 2 middle school boys. After her ex-husband left her and her then toddler boys 11 years ago, Nancy decided to work overtime to make something of her life. With the help of her parents, who helped her look after her son, she returned to school to get a nursing degree. And for the last 8 years, she's worked both in hospice and acute care settings, always feeling immense satisfaction in her work. But lately she confides in you, her coworker, that she just hasn't been feeling her old self. The spark just isn't there anymore, she tells you. Patients are sicker and more demanding than ever. Their families are just impossible. And my supervisor, you cannot please that woman. She continues, with all the cutbacks, I know I should be grateful I have a job. I can't afford to quit. But honestly, some days I wish I could get a nice fat severance check so I would have a reason just to leave this place behind. I think that is the perfect illustration of compassion fatigue. So I hope you can recognize some of the symptoms of compassion fatigue in Nancy's story, and you might see some of these in your own work. Anger, get out of my face. That cynicism, it just really doesn't matter anymore. Apathy, I just don't care. I don't have that same spark that I used to have. Sometimes people may feel an increase in the need to relax type of habits like tobacco or alcohol. That sensing that I'm trapped in my job or duties. I can't quit, but honestly, some days I wish I could just get a nice fat severance check. The conscious reluctance to deal with her patients. Patients are just getting sicker and more demanding than ever. And then that emotional distance or detachment from others. My boss, I just can't please that woman. So how do we combat compassion fatigue? How do we get that spark back if we've lost it? How do we keep that spark going to not feel fatigued? Well, we want to reestablish our call to helping others. We want to work to achieve a life balance, and we really want to make sure that we build in accountability. Remember your calling. I was having this conversation with someone yesterday. Becky, how did you end up working for O'Connor Mortuary? And I told my story, and tell your story. What got you interested? What was that spark that got you interested in doing what you're doing? Do you remember what that was that thought, this is my calling. This is what I'm meant to do. What are your priorities? And what sort of goals, and long and short term, and we're going to talk a little bit more about that, have you set for yourself that focuses on that calling? We're going to talk a little bit about finding a life of balance. Many of you it's 24/7 that phone is attached to you, taking calls at all times, helping families at such a high level of care that you sometimes forget to balance that out with time for you. We're going to talk a little bit about creating a supportive network and those three entities: mentors, colleagues, and students. And then expressing gratitude daily. It sounds simple, but it is so important for us to be appreciative and find those joys in our lives. So stress, the dreaded word stress. When we hear the word stress, it brings up a negative connotation. A divorce, a death of a family member, a serious illness or injury, job insecurity, work overload. But I think we have to remember that stress isn't always bad. Some examples of good stress: change. We all experience change. It can be scary, but it can also be a wonderful new experience for us. Being a beginner at something. Oh my gosh, I'm learning a new skill. I'm trying something new. I'm going back to school to further a degree or get a new degree. Things that are meaningful to you, but make you maybe feel a little bit afraid and uncomfortable. Sometimes we can perceive stressful situations as an opportunity that will lead to a good outcome. So we want to focus our own key priorities so that we balance our stressors. We use our positive stress to motivate us to balance our negative stress that causes us anxiety and fear. Something else we want to do is connect our mission, our values, and our time resources. So how do we find our personal key priorities? Well, I think we want to look at our own personal psychological resilience. How do I respond and adapt to those bad stressors, those threatening feelings, those potentially life-altering events or processes in my life? And then we look at our own feelings of control of our life. How control do I feel of my own life? Do I have people I can turn to if I need to? That is so critical, and we're going to talk a little bit more about having that person. And then the sense of purpose. What is my mission and purpose in life, and is that clear to me? I like this little graph. You see the rank, value, meaning. And meaning making is a form of sense making. Meaning making is a process of how we construe, understand, and make sense of our life events, relationships, and of ourself. And values are things that each of us believes are important in the way that we live and work. So our personal values coincide with our meaning making. They determine our priorities. Those priorities we were just talking about, those key priorities in our own personal lives. And when our values coincide with our meaning making, that's usually, and they're aligned, that's usually when life is good. So for example, service to others is one of my top values. For me, it coincides with my work in grief support and education. I rank that number 1 or 2, my value and my meaning. So those coincide, those align, life is good. So this is just an easy tool to use to define and rank your values with your meaning making. I think it's important to remember that this process is fluid. Values that were important to you in the past may not be relative to you now. So this is even a nice thing to go back and review maybe once a year. And then striving to live by our priorities every day. This can be a challenge. we all need downtime. We all have our moments of wasting time. We certainly all have our moments of crisis. We have our moments of deception. But ultimately, you see in these 4 quadrants, we want to try to focus most of our time being in that quadrant too, the quadrant of quality of personal leadership. Things are important to me, but it's not urgent in the fact that it's a crisis, but it's bringing me joy. It's part of my personal value. It's part of my meaning making. So in creating your own personal self-care strategy, you want to set goals for yourself and follow your plan. Beginning of the year, I don't know how many of you have set New Year's resolutions. Maybe some of you have broken New Year's resolutions. I was just listening to a radio program, and I think it was January 3rd, and they were having people call in who had already broken their New Year's resolutions, and it was pretty funny to listen to some of those things. But I think it's really important for us to remember to set realistic goals for ourselves, so that we can follow that plan. Maybe pick 1 or 2 things, not everything. To build in accountability, do you have staff or coworkers or a good friend or family who can, you can check in with and have that accountability and work together on self-care strategies. And I also want to talk a little bit about parallel narratives. One of the stressors in our lives that can lead to compassion fatigue is this self-blame. This was my fault. I did not do it well enough. Don't try to talk me out of this. We blame ourselves for things. Even if we know it may be irrational, that's still in the back of our head, still nagging at us. This was my fault. I didn't do this well enough. I'm not good enough. I could be better. And I think a lot of times we try to, this doesn't make sense. I know this isn't right. We try to push it out, but it keeps creeping back in. With the idea of parallel narratives, instead of trying to replace these negative narratives, use parallel narratives. Listen for the other story in your life instead of trying to replace. And bounce back and forth between the two. Maybe some mindfulness exercises. Intend to be grateful, that, being grateful every day piece. I'm loving, I'm compassionate, I'm charitable, I'm happy. Even though part of you may not always see this. So when those negative thoughts creep in, balance them with the parallel narrative. And sometimes, it's okay to live a little with that experience with some of those negative thoughts. Don't shortcut your way through it, but balance it out with the positive. Another way we can avoid and prevent compassion fatigue is the practice of keeping up. And this is basically continuing to grow intellectually in world events, in a cognitive capacity, and I think especially in our own fields. Doing what you're doing today, logging into a webinar, going to a seminar, reading a journal, doing an internet research or reviewing a book. These are all great ways by keeping up in our field, that rejuvenates us and gets that spark back again. So these are just a few examples of how we keep up with our professional development. Doing what you're doing today, maybe join a relevant association. We have some great associations and groups here in Orange County. Reading current literature, really important. That second to last bullet point, communicate what you learn to others. At O'Connor Mortuary, really the past 2 years, We've spent a lot of time sharing what we know with each other internally. If I go to a conference and I find some things really fascinating, I'll bring 2 or 3 of those ideas and those bullet points back and share with the team. Hey, I want to let you know, here's what I learned. Here's and you'll feel that spark coming back again. And then visioning future plans and programs. Things are great today, but what are we going to do tomorrow? How are we going to move forward? How are we going to make our work, our profession even better? And then attending to our physical well-being. And I know everybody knows this, and it is so very important that that we all are the best that we can be, and we focus on our physical well-being. When we are well, we're able to serve our clients, families, patients in the highest capacity. So eating right, what we eat, how much we eat, when we eat, moving our body, resting well, and laughing often. So just an easy relaxation exercise that you can do anywhere. You can do it for a couple of minutes right in your office, if in your car, if you're traveling a lot to and from different clients and patients. Just sit down or lie down comfortably. Try to prevent interruptions, put the phone on silent, turn the radio down. Just remain inactive for a couple of minutes. Put any troubling thoughts away for a predetermined amount of time. Okay, for the next 3 minutes, I'm going to push these thoughts aside about all of these things that I have to accomplish today. Stretch, breathe, visualize, and focus on muscle groups. If you can just take a couple of minutes, maybe 3 to 5 minutes, a couple of times a week, to do a relaxation or a breathing, hopefully you're going to see that stress level go down. And then developing our emotional self. So we've been developing our emotional language since before we could even talk. When we were all infants, we learned how to express our feelings to events in our lives. And as we grew, we learned to read the cues that indicate other people's feelings. And as adults, we can shift, and we have this thought that we need to be happy and content at all times. As children, we saw, felt, read the different emotions, and as adults now, we've thought, oh my gosh, if I'm not happy, there's something wrong with me. A stronger mental health is correlated with experiencing range of motion, a whole range of motions, and allowing ourselves to feel what we feel. It kind of goes along with that parallel narrative that we talked about. It's okay to have moments of feeling sad, angry, bored, frustrated. Allowing yourselves to feel those along with the joys and happiness of your life can really help you emotionally and help you with your stress. And then connecting meaningfully with people, with vital, important people in your life. Of course, your family, of course, your friends, but colleagues, mentors, and trainees. Every one of us should have these 3 things: colleagues, mentors, and trainees. We should each identify someone in our life who we look up to, who we see as our mentor, as one of our teachers. For me, it's Dr. Bill Hoy, and I know many of you have attended Dr. Hoy's workshops. He is one of my mentors. I learn from him. He's a great inspiration and educator for me personally. And then colleagues. Who are our peers in our work field and in what we do? Some of you may have associations that you belong to. where you have colleagues that you can meet with and bounce ideas off of. I belong to a study group of other individuals who do grief support and education for the funeral profession across the United States and Canada. And we meet one time a year in person for about 3 days to talk with each other. What's going well? What are our struggles? What's working for us? What's not working for us? What are our frustrations? And we're able to connect with each other as needed if we have issues that arise. And then trainees, who are we bringing up? Who are you individually bringing up underneath you, behind you, to be the next great healthcare professional, the next great board and care owner, the next great hospice clinician? Who do you see personally that you're mentoring and bringing along in our profession? So think about that. Identify somebody who is your mentor, your colleague, and somebody that you're mentoring, somebody you're bringing along into our profession. And then developing our spiritual self. There's a great quote. I'm going to read it to you. It says, "It's incredibly easy to get caught up in an activity trap, in the busyness of life, to work harder and harder at climbing the ladder of success, only to discover it's leaning against the wrong wall. It's possible to be busy, very busy, without being very effective." And that is a quote from Covey. I know you all remember, if any of you remember the Franklin Covey planners back in the 80s. That was something he said, and this sticks with me because I think, climbing the ladder of success, only discover it's leaning against the wrong wall. And I see so much of that today in our world, that we're so focused on being busy. Oh my gosh, I don't have enough time to do anything. I have this and this and this and this and this. That sometimes I think we have to take a breath and realize, gosh, is my ladder leaning against the wrong wall? So think about that in your own personal life. What can you do to cut out some of that busyness that will actually help you be more productive and focus more on your life's purpose and mission? And then life beyond work. Another one of my favorite quotes: "There's no such thing as work-life balance. It's all life. The balance has to be within you." And I love that. We talk a lot at O'Connor about the fact that we often spend more time with each other, our O'Connor family, than we do with our own personal families. And so life is life. When we're at work, we're still living life. So it's important to see that and prioritize, and I think really make deliberate choices. We need life beyond work. We need hobbies. We need interests. Maybe you want to volunteer, but in a non-related field to what your work is. Maybe you have the ability to travel. But again, making this a priority and making deliberate choices to put the work down and do something outside of the scope of work. And then being aware of our values and guiding principles. We spent some time earlier talking about aligning our values and meaning making. Being aware of our personal guiding principles is really about taking ownership of our values and our beliefs. This is what helps us make tough decisions and navigate major changes in our lives with minimal stress. And another thing we need to do is learn to reframe unhelpful supportiveness and focus on what is true support for us. We all have people in our lives who are well-meaning, but maybe frustrate us when they try to help us. What we must do is find one person. If you do nothing else from this presentation today, identify that one person who has your back. We all need that one person who, no matter what, we can call and we know that person is going to be there for us. So think about that. If you don't have that one person, fix that today. Think about that one person who will always be there for you. And then connecting with needed support. Study after study shows that the more we are connected and have a support system in place before a stressful event, a traumatic event, a major illness, whatever that stressor may be, the better off we are in for long-term good health. So the support we have in place now is correlated with how we will handle a stressful situation. So find those people, community-based resources, support groups, spiritual support, therapy and counseling. But some of the very best connection is that organic support that we have from those closest to us. There was a study done in 2009 on nurses, and it was the stress satisfaction relationship. So they studied nurses and the nursing supervisors and looked at the nurses with high social support from coworkers were more satisfied with their jobs than nurses who self-identified with less support. There's another study that was done with, it was Operation Enduring Freedom and operating with veterans who were a part of Operation Enduring Freedom, and they reported lower post-traumatic stress disorder, lower levels of anxiety, lower levels of trauma when they had that social support of other veterans. So again, find that person. And I think, you know, in my own personal life, I look at 3 or 4 key people who I know I can absolutely go to and who may push me a little bit to think of things and to do things and to try new things, who encourage me, who are willing to listen to whatever that may be. But find that support, find that organic support within your circle of friends, colleagues, supervisors, but also know that you have additional community-based resources and therapy if you need to. So creating a personal plan of action. This is something that you may want to do. You see your mission, intellectual, physical, social, spiritual, diversion, you know, things that you want to do immediately, things that are more long-term. One thing that I wanted to talk a little bit about as we talk about a personal plan of action is my colleague, Molly Keating, who works with me at O'Connor. She wrote this wonderful blog for January, and she talked about the fact that, you know, New Year's resolutions aren't really for her, but something that she came across she absolutely loved, and it was, if you could pick only one word to be your theme for your year, what would that word be? You know, and she said in her blog, this intrigued her, you know, and she thought and thought and thought about, gosh, what's only one word that works for me both as an inspiration and as a struggle for the year. And for her personally, she chose the word open. She said open-hearted, open-minded, open-armed, open house, open book, open to you. And she loved this word for all the reasons above, but also that it inspired her not to remain closed to others. And a very personal meaning for her. But I love this idea, and several of us who read her blog, we've picked our words. And it took some time. It took a few days to kind of think through what that may be. It may be a cinch for you to figure out your word, or like me, you may really need to think about it for a while, but I think you'll know your word when you land on it. Some people even Googled one word, and different words came up, and that helped them kind of create what they wanted their word and their mantra to be for the year. So I encourage you to take a moment or two and think about what this word could be for you, and then share that with that person who has your back, with that support system, with that close circle, and see how that relates to your personal plan of action. The last thing I want to talk about is the use of grounding exercises as a way to help us battle compassion fatigue. So Karen Monster Peters is a psychologist who gives us grounding tips for everyday life. So what exactly is grounding? Well, it's a way to help us reduce stress, to come back to the moment, and to bring ease and flow back into our world. So grounding really just means bringing yourself out of your head and into your body. And it's really about reestablishing a connection between the mind, the body, and the soul, so that you're present in the moment rather than trapped in all of those thoughts that are millions and millions of thoughts that are running through our heads every day at any given time. So how does grounding help? Well, when we connect our body to we connect to the present moment. We see what is right in front of us, and we respond from a place of alignment rather than a place of anxiety or depression or fear. So in that particular moment, all is well. A little bit like that relaxation strategy that we talked about earlier this morning. So it not only brings us back to the now, but it really helps refresh us, de-stress us, and rejuvenates our entire being. Any of these methods, any of these things can help us be more present and more clear. And I think the best thing of all is, again, just like that relaxation technique, it can take only a few minutes. We can give ourselves just a couple of minutes to be in that moment, to focus on that grounding, to rejuvenate ourselves to go along with our day. So, in conclusion, this is a self-care plan. What do I do for self-care? Take some time to create your own personal self-care plan. Make sense of your stress. Focus on your physical, spiritual, emotional well-being. Practice keeping up. Connect your mission, your values, and your time resources. Do something for fun and enjoyment. Find your person who has your back. Practice grounding exercises. And think about your one word for this year. Thank you all for attending today. I think we have a couple of minutes left if we have any questions, Kim.
Yes, please stay on the line, everyone, because this is your opportunity to type any questions that you have for Becky into the chat box in your control panel. And while we're waiting for that, we do have one question that came in, and we have an attendee who dialed in from Arkansas, and he is a caregiver for his wife with dementia, and he's been the primary caregiver for 8 years. And so he is really feeling the weight of, you know, that stress that comes with 24/7 caregiving. So I know this is a huge issue in the dementia field for families as well as professional caregivers. And so I have sent him private information on how to contact an Alzheimer organization in his area. But I wondered, Becky, if you want to talk a little bit about the risk for compassion fatigue for dementia caregivers.
Oh, absolutely. And I just want to say that we are all thinking of you here in Orange County, and we commend you for what you're doing, and thank you for being such a wonderful caregiver within your family. And thank you, Kim. Of course, that would be my first recommendation, is to connect him with resources in your area for Alzheimer's and dementia. And I think the one thing I say to family caregivers, first is give yourself grace. Allow yourself to feel all of those feelings and emotions that you're going through, because your job is an extremely difficult one. You're doing it out of love, but I know there are moments of huge stress and anxiety. So give yourself grace. Take care of yourself. Personally, you are only as good as you are healthy. So find ways to put yourself first at times and take care of yourself.
That's great, Becky. Thank you. Yes, I think all of us appreciate the tremendous love that goes into personal caregiving. And of course, we feel that as professionals too. And so we wish the gentleman the best of luck. And sir, please reach out to me privately if you like, and I'll be happy to talk to you with give you more resources. I had a question, Becky. I was just kind of going back to the mention you made of the RCFE environment. And
Yes.
sort of that push-pull that goes on between staff and families. It's sometimes, a bit inevitable, and that creates stress all the way around. One of the things that I wonder about is, do RCFEs create some kind of mechanism for staff to talk about the stress they're going through, and even more specifically, what about some kind of mechanism for staff to grieve a loss of a client in their RCFE? I'm just wondering if how we might do that.
Oh, absolutely. I think that is so valuable and such an important part of the team there being healthy and staying connected and feeling good about their tremendous, wonderful, exceptional care that they give to the clients in their homes. I think sometimes we forget about the staff when someone dies, or when maybe someone moves out. And again, it doesn't have to be a death loss, but maybe has to go into an acute setting, or maybe has to go on to a next level of care. That is a loss. And in RCFEs, the caregivers put so much love into caring for the clients in their homes, that one easy way to well, first of all, just allowing people to talk about it, maybe having a staff meeting and sharing feelings. But I think ritual is also another great way to express those feelings. Maybe everybody sharing or writing down a favorite moment with that particular resident, or maybe doing a rose ceremony. And you can take a petal off of a rose or another type of flower, and again, share a favorite memory. So any type of ritual, maybe putting a picture up of that individual lighting a candle in memory of that individual, any type of ritual that can allow people to mark the loss and express their feelings of how important that person was in their lives.
That sounds great, Becky. And I think, too, we can look to our colleagues in hospice for some models and ideas, because I know that
absolutely,
the hospice industry, makes sure that their volunteers and staff are supported when there's a loss with memorial services, etc. So I think those are all really good ideas. I have another question. One of our attendees is asking, she or he says, if I don't have an inspirational mentor, where can I find a person like that?
Great question. I would think if you wanted a mentor within your field, I don't know what your exact field is, but again, and look in that keeping up and looking through journaling, finding professional groups, being a part of seminars and webinars, going and hearing, going to training sessions and seminars in your particular line of work. Look for those people who are the ones doing the educating. That's actually how Dr. Hoy became my mentor. Before I even worked for O'Connor, I used to go and listen to him and participate in his workshops that he did. And then over the years, and ended up starting working for O'Connor and following him, working more closely with him. But originally it was because I went to hear him speak. And there are a couple other people in my life who are mentors that came about from me being involved in seminars that they were conducting.
That's great, Becky. I think too, I guess the only thing I would add is perhaps if you're a member of a professional association or even a networking group. I know that people that attend networking groups on an ongoing basis form pretty tight bonds, with some colleagues, a lot of the colleagues there. So, and if you have someone in mind, and don't be afraid to ask. I would say if you have a colleague or someone that you respect, I think it would be good to ask if there could be some mentoring from time to time.
Yeah, I think
all
that,
of us who are
absolutely.
professionals, we consider that an honor to mentor other people.
Absolutely.
So, any other questions? Just checking the box here. I think that's it for the questions. I just want to look at my notes, Becky, and see if I had anything else. Oh, I just wanted to kind of make a broader statement after considering our gentleman from Arkansas. I just wanted to make a bit of a broader statement and maybe get a comment from you, Becky, just on the whole issue of compassion fatigue in dementia. And I know that I'll just share personally that, for someone like me and maybe many others on the line, we've been at it for a long time. And I think one of the things I struggle with, and perhaps others do as well, is just the toll of dementia. And, the sort of continual process of working with clients who are not going to get well. We know that they are going to continue to progress. And so anything you might want to add about that? Or maybe there's no solution, but I just kind of wanted to emphasize it.
Well, I think you're right, Kim. I don't know that there is a solution, and as much as we want to fix it and make it good for you and make it good, make it good for the gentleman in Arkansas, I think that's our first thought is like, oh my gosh, I want to fix it for him. And as you said, those of us who have been at it for a while realize we can't fix it because it's not going to progress in the way you would want it to progress. But as hard as it can be, finding those moments of joy, and through the struggles, through the stress, through the compassion fatigue, finding those few minutes once a day to where you're seeing the joy, where you're in that moment, where you're maybe able to have a good laugh. They may be few and far between, but cherish them, relish them, live in that space for as long as you're able to.
Absolutely, absolutely. And I think that what balances that for me is just knowing that as a worker, I'm providing some joy for the journey, and helping to improve the quality of life of the person with the disease and their families. So there's a great deal of job satisfaction in that. So
yeah, and I think especially for this gentleman is to take advantage of the resources out there. I think so many times over and over again we have seen families who wait. They're waiting for what they think may be the rainstorm and the crisis, when in reality they're already living that crisis. So take advantage of the wonderful resources that are available within your community. It is not failure to bring help and support in from the community. It is an act of love, and it is something that will help you and the person you're caring for.
Well said, Becky. Okay, any other questions from our attendees today? Becky, I want to thank you so much for this very timely and very important topic. And even though there weren't a lot of questions, I think you gave us a lot of food for thought. And I think that the things that you said really affected each and every one of us who were part of the morning. And so we thank you for your time and for sharing your expertise. Again, to everyone online, watch for the evaluation. It must be completed within 5 days if you want to get CE credit for today's class. You'll get a flyer soon for our next topic. Next month, we have an excellent speaker, another excellent speaker, I should say, Debbie Ricker, who is the Executive Director of the Adaptive Driving Center. And she is an expert on safety issues for older adults. So the topic is Too Old to Drive, Safety Issues for Older Adults. And so I think this will be a really excellent topic for us to explore together. So we hope that you will all join us next month. Thank you for being part of the webinar today. Thanks again to Becky Lamaka and to our community partners, O'Connor Mortuary and CareChoice Hospice and Palliative Care, as well as Alzheimer's Orange County. Everyone have a great day, and thank you.